For millions of Americans, healthcare isn't just a policy debate, it's life and death. And when one of the largest health insurance companies in the country is accused of defrauding the very system meant to protect seniors, it sends shockwaves through every household. This is the story of UnitedHealthcare, Medicare Advantage, and one of the most significant healthcare fraud allegations in U.S. history. UnitedHealthcare is a titan. With over 50 million members and hundreds of billions in revenue, it's the largest health insurer in the United States. Among its most profitable programs, Medicare Advantage, a system where private companies are paid by the federal government to manage Medicare benefits. Here's how it works. Under traditional Medicare, the government directly covers a patient's healthcare costs. But under Medicare Advantage, companies like UnitedHealthcare get a fixed amount of money per patient, adjusted by how sick that patient is. The sicker the enrollee, the higher the government's payment. That system was created to help companies manage high-risk patients. But it also opened the door to fraud. Because if companies overstate how sick their patients are, they can collect more money, billions more. And that's where UnitedHealthcare finds itself today. In recent years, whistleblowers and federal investigators have accused UnitedHealthcare of engaging in a systematic campaign to exaggerate patient diagnoses. The practice is known in the industry as upcoding, a form of manipulation where insurers report that patients have more severe or complex illnesses than they actually do. Why? To maximize federal payments. According to a 2017 lawsuit filed by the Department of Justice, UnitedHealthcare knowingly submitted false data to inflate risk scores. One internal document even allegedly described efforts to avoid audits and cherry-pick diagnoses that would result in higher revenue. In a separate civil case, whistleblower Benjamin Poling, a former executive at UnitedHealthcare, claimed the company created financial incentives for medical coders to find and report extra diagnoses, whether or not they were accurate. He stated bluntly, UnitedHealth used every trick in the book to make their patients look sicker than they really were. Estimates suggest that these fraudulent risk adjustments may have led to billions in overpayments from Medicare to UnitedHealthcare and other insurers. In one review, the federal government found that a sample of patients coded by UnitedHealthcare had vastly inflated diagnoses, many of which had no supporting medical evidence. The DOJ's case focused on whether the company knowingly submitted false information to increase its reimbursements. And though UnitedHealthcare has denied wrongdoing, the scale of the potential fraud sparked outrage. The accusations go beyond a few bad actors. Critics allege that the entire Medicare Advantage business model incentivizes abuse. When more than $400 billion flows annually into a system with weak oversight, some say fraud isn't just possible, it's inevitable. So what does this mean for ordinary Americans? For starters, taxpayers are footing the bill. Every inflated diagnosis drains public funds from programs that desperately need it. And more than money, there's the cost to patient trust. When doctors are pressured to code patients as sicker than they are, it can lead to unnecessary tests, misdirected treatments, and even psychological stress for patients falsely labeled as chronically ill. This isn't the first time Medicare Advantage has come under fire. In fact, almost every major insurer in the program has been accused of similar tactics. But UnitedHealthcare, by virtue of its size, has become the poster child for how massive and unchecked this issue has become. In response to the investigation, UnitedHealthcare said it is confident in its data reporting practices and is cooperating fully with the Department of Justice. A spokesperson claimed the company follows CMS rules and regulations and takes compliance seriously. But legal experts say the scale and duration of the alleged fraud raise serious questions about how deeply the misconduct runs and whether it was part of an intentional corporate strategy rather than isolated incidents. As pressure mounts, federal regulators and lawmakers are taking notice. In early 2024, proposals were introduced in Congress to tighten oversight of Medicare Advantage plans. Suggested reforms include mandatory third-party audits, stricter penalties for over-reporting diagnoses, and limits on executive bonuses tied to inflated risk scores. One proposal, called the Medicare Integrity and Fairness Act, aims to give the Centers for Medicare and Medicaid Services more power to reclaim overpayments. Another calls for full transparency of how insurers calculate risk scores and public disclosure of audit results. But critics argue these reforms are long overdue. In 2022 alone, Medicare Advantage overpayments were estimated at over $20 billion, a staggering figure that some say is only scratching the surface. Whistleblowers continue to step forward. One former nurse working under a UnitedHealthcare subsidiary said she was instructed to call seniors and ask leading questions that would result in sicker risk codes, even if the patient was healthy. She said, "It stopped being about care. It became about code mining." This is the uncomfortable reality. The most vulnerable population, seniors on Medicare, may be pawns in a game of corporate profit. And it doesn't stop at UnitedHealthcare. Recent investigations have opened up scrutiny into Aetna, Humana, and Cigna, all major players in the Medicare Advantage space. But when the largest fish in the pond is under federal criminal investigation, the implications for the entire system are monumental. At its core, the UnitedHealthcare Medicare fraud case exposes a flaw in the intersection of healthcare and capitalism. When financial incentives favor exaggeration over accuracy, and when oversight is weak or underfunded, corruption doesn't just become likely, it becomes standard practice. If this story matters to you, hit subscribe. At Crooked Stories, we expose the fraud, the cover-ups, and the financial crimes that shape the world. 2 new documentaries every day. No fluff, just facts. Disclaimer: this video is for educational and entertainment purposes only. All information is based on publicly available sources. We do not provide legal or financial advice and are not responsible for any actions taken based on this content.